Hello and welcome to the third session in the menopause series, where we will talk about the symptoms of menopause. Remember, menopause is a natural process for us women. It's a part of aging. It's not a disease, and therefore it cannot be cured. However, many of the symptoms can be managed so that we can have a decent quality of life. The symptoms that we'll discuss will vary with different people. One of the factors that will determine how you experience the symptoms of menopause is your genetics. Therefore, some people will experience it earlier on in their life than other people. And some people might experience certain symptoms and not other symptoms. Also, the severity of the experience will also vary. Even the time of the menopausal stage will vary. Some people may just experience a symptom over 2 years, and others might go as long as 10 years and beyond during menopause. So it's all dependent on your genetic factors. The other factors that might play a role include your culture, your ethnicity, and your lifestyle. For instance, if you have a history of smoking, it is thought that people who have a history of smoking will often experience menopause earlier on in their life than women who didn't smoke. The other belief also is that Black women often tend to experience menopause earlier than people from other ethnic groups, and that some symptoms might even be more intense for Black women than for women from other races. So these are factors to bear in mind when you. I actually have a friend who went through menopause, and when you talk to her about some of your issues, she has no idea what you're talking about. So that goes to tell you that we're all different in the way that we handle these issues. So let's go straight into the symptoms of menopause. The first symptom that I will talk about is irregular periods. This is often one of the first indicators that something is changing, your periods. When I say irregular periods, I mean if you are a 28-day person in terms of your cycle, you may notice that the period becomes longer or shorter. So instead of 28 days, you may get 25 days or you might get 35 days. The other thing that might change also would be the length of the actual bleeding time. Some people typically would have 4 days, but you might find that even though your cycle is regular, it comes every 28 days, but the length of the bleeding will be affected. Either it's shorter or it's longer. Another thing that you might notice would be that with time that your periods may completely stop and restart. But remember that until your doctor tells you that you're in menopause, the chances are that you're not in menopause. And so whatever happens, make sure that you continue to use whatever form of contraception that you be using, because as long as your period is irregular or you're not sure where your cycle is, the chances of pregnancy are there. So that's one thing to bear in mind. The second symptom of menopause is hot flashes. This is the most challenging and the most troublesome for many women. I certainly had, and I'm still having huge problems with hot flushes. Flashes, depending on where you are or where you come from. This basically just means that you're feeling heat, you're feeling hot in your upper body. So we're talking about your face, your neck, and your chest. Sometimes it might just be the feeling of heat internally. And in some cases, you actually break out in a sweat. Now, it can vary. Some people might just experience a hot flash 30 seconds. And for some people, it will go on for minutes. For some people, it might just be hot flashes every now and then. And for other people, they would flash several times in 1 hour. And I can attest to this because at a point, I was experiencing about 20 flashes in 1 hour. The primary reason for hot flashes is a decline in estrogens. This will cause the system that controls your body temperature to begin to malfunction, and therefore will cause the thermostat in your brain, the hypothalamus, to misinterpret signals of heat. This is where the hot flashes are from. And a study actually shows that Black women are 50% more likely to experience hot flashes than people of other races. The third symptom I'm going to talk about is vaginal dryness. This is again due to estrogen, because estrogen is responsible for maintaining the vaginal area. So low estrogen levels is going to cause dryness and thinning of the area, making intercourse more difficult and also causing the area to become more prone to injury. So that's something to bear in mind as you go through menopause, that when the dryness begins to happen, that also means that the area is vulnerable to injury. The fourth symptom of menopause I'm going to talk about is difficulty in sleeping. Low levels of hormones will affect the sleep wake cycle. And so it becomes more difficult to fall asleep as well as difficult to stay asleep. So it's not unusual to hear about insomnia when people are going through menopause. This is also complicated by night sweats. Just think about it. If you're having trouble falling asleep, you're having trouble staying asleep, and then you have night sweats. A combination of those two is definitely going to affect how much sleep you get. Another symptom of menopause is low mood and anxiety. No one knows exactly why this happens, but it is believed that low levels of these hormones would often cause a reduction in the amount of neurotransmitters in the space that are required to maintain mood and be able to function properly. And people might end up being more anxious and even end up with depression. Another symptom of menopause is low sex drive or low libido. And this again is purely hormonal, that because of the lower levels of these hormones, people's libido will be reduced. And so when someone is getting to that age and you notice these changes, don't forget menopause. Another symptom of menopause is urinary tract infections. Now, it is not to say that you will not experience urinary tract infections ordinarily. However, you may find that the frequency of these infections might increase at this time. And the reason, again, is because of the hormones. The hormones are usually in charge of maintaining the integrity of these areas. And so when the decline of these hormones begin, you will find that the areas are drier, and the bacterial flora that are responsible of maintaining the pH of the area will be affected. And so women will end up getting more frequent urinary tract infections around this period. Another symptom of menopause is weight gain. Now, a decline of these hormones will affect the way the body handles fat. And it is very common to find that as you get older or as you get to this age, you might find that it's easier to store your fat around the abdominal area. This is something that needs to be remembered during menopause. There are other kind of side factors that sometimes may cloud the picture a little bit. For instance, as you get older, your muscle becomes or your muscles become weaker and your metabolism slows down. And so a combination of these two would cause you to put on weight. So this is something that we need to be considerate about. Lifestyle can also further complicate the issue. So if you have a woman who's going through menopause, whose body, the way the body stores fat has changed, a woman who is getting older and therefore the metabolism has slowed, and then a woman who is not modifying their lifestyle accordingly would cause a problem with weight gain, which will then result in other complications, as we know. Another symptom of menopause is joint pain. And this is again caused by hormones. So lower hormones means that your joints are not going to be as lubricated as before. You will begin to feel a pain in your joints. Sometimes it's one joint and the other one is another joint. So it's good to remember that as you get older, you need to take care of your joints. You need to be careful what activities you participate in, because at this point, injury is very, very easy. And also, if you have gone through multiple pregnancies, and sometimes after pregnancies, your joints are not always the same. So a combination of that and menopause could put you at risk of injuring yourself. So this is something that we must remember during menopause. Joint pain, it can be felt by different people in different ways. It could be sharp pain around your joint areas. It could be difficulty in doing certain activities. Changes in your hair thinning, losing your hairline, and dry skin are symptoms. And you need to do better with your moisturizing of your skin. I certainly have experienced the losing my hairline, and my hair doesn't grow as much as it used to grow. So this is also something that can happen during menopause. The last symptom of menopause that I'm going to talk about is brain fog. This is very real. No one knows exactly why it happens, but it is thought that a decline in your hormones can actually affect your cognitive function. So you will find that you don't concentrate as much as before, you're forgetful, you have difficulty in concentrating, you're easily distracted, and sometimes you want to express yourself and you just cannot find the words. Now, the symptoms that I have talked about are not all the symptoms. These are the main symptoms that most people feel. Like I said, some people won't even feel any of these. And I'm sure that you have symptoms that maybe you have gone through that I haven't shared. Please share in the comment section what symptoms you've experienced that I have not mentioned. And until my next video, I'll see you again soon. If you have learned something from this video, please like the video and share it with your friends. And I'll see you soon. Goodbye.